Hey guys, Dr. Manrina Rhode here, and today I want to talk to you about black triangles. So black triangles are obviously the little black areas that you get between teeth, which can look like there's food stuck between your teeth or like a dark area there. And there's lots of reasons why they might exist. They could exist because you have periodontal disease, gum disease, bone loss that has caused the gum to recede. They could exist after orthodontic treatment due to the shape of the teeth and the way the teeth and gums have moved that have created them. They could exist because you've had a tooth removed and you've got a bridge or an implant to replace it, and the papilla hasn't been recreated. And in implant surgery, it's infamously difficult to maintain the papilla, you know, that little crest of bone that implantologists are like, oh, when you extract the tooth, leave that little piece of bone that's there. And then equally with a bridge, very difficult to try and recreate that papilla around a tooth. And so, yeah, there's a whole multitude of reasons. Or it could just be to do with a cleaning habit that you have, the TPs you're using, or the way that you're cleaning, or the way your retainer fits that's blunted that papilla for you. If we're dealing with a periodontal condition and bone loss, then obviously the most important first thing to do is to stabilise that periodontal condition so the bone loss and gum loss don't continue. Once your periodontal condition is stabilized, then typically we know that if the top of your contact point sits within 5 millimeters of bone, then the papilla will fill in that gap. So you want to see, if you've not had any bone loss, great. If you have had some bone loss, then you want to take your perio probe, pop a little bit of numbing gel on the gum, pop your perio probe in. Maybe you want to even give a drop of local, and maybe topical's enough. Pop your probe in and measure at what point that probe hits bone, and then you'll know where 5 millimeters is and where that papilla is quite likely to fill in, and see whether with the design of your restoration, if you're able to close your contact point high enough to recreate a papilla, or whether that's going to create a ledge. Like if you imagine a veneer or a crown or a veneer and you're making the contact point too long, then it becomes like a ledge there that's then not cleansable. You know, you want a nice smooth contact point join between the teeth. So that's something to consider. And maybe that black triangle's there for another reason, just because you've been using big teepees, or you've had some ortho and you've ended up with it. What are we going to do? What are we going to do about it? So there's a couple of options here. I guess the most obvious option, and the one that was traditionally done, was black triangle reconstruction using composite, using composite fillings. And so we would try and do a beautiful composite filling. You know, it's quite popular to use a BioClear matrix for these. They're designed especially to help, especially shaped matrices to help us to be able to close those areas because it's curved. But the thing with that is that you need to make sure that they're highly polished, because the interproximal area is notorious for picking up stain, and composite is that much more notorious for picking up stain as natural tooth is. So if the natural tooth is picking up stain, then it's quite likely that your composite filling will too, unless it's very highly polished. So if you're going to pop composite there, highly polish it. Warn the patient that it's really important that they maintain flossing and cleaning in the right way. Their whitening trays could help to keep those stains at bay, regular hygiene visits, an electric toothbrush, so they can keep those clean. And when they come and see you for checkups, that's something that you may need to polish for them. And then more recently, we've been using gum fillers. I brought the gum filler treatment to the UK about 8 years ago. I learned it over in the States, and then brought it here, and other people have been picking up on it since. And gum filler is taking filler that we use, hyaluronic acid that we use in the face, and then placing that into the papilla to allow it to expand slightly. Now, gum filler doesn't work very well on a very tight papilla because there isn't space for that filler, and also the filler will typically want to extrude out from the hole that you've created to put it in. So there's only a tiny amount that you can add there. So gum filler is a really lovely solution, but only for very minimal black triangles or minimal improvement in your black triangle. If you've got a large black triangle, like often you might have on lower teeth after perio or after ortho, then gum filler is only going to give the papilla a little bit of convexity. It's not going to fully close that black triangle for you, so it's really case dependent. If you would like to learn more about gum fillers, then I am creating an online course about this. I'm aware that there is no education available, and so many people contact me saying they cannot find a course to learn how to carry out this procedure, and I'd love to share with you what I've learned over the last 8 years of carrying out this procedure on so many of my patients, so that you can also bring it to your clinical practice. We have an online course register interest here portal, and we will share the link underneath in the copy, so click on there, pop your details in, and we can hopefully get you started with that very soon.